What session are you most looking forward to and why?
Well, I think the whole workshop is very important for me because it's a regional meeting where a lot of experts from the region are here. It's good to learn from them about their experience, their knowledge about this infection. It has been a challenge for a couple of years in the region and for the whole world. So I'm looking forward to listen to different sections related to how to investigate, what are the surveillance experiences, and how we can better respond in the future.
Building on past experience of managing MERS outbreaks in 2014, how did the Abu Dhabi Health Authority build its public health system for detection and response to such threats? Is there anything that other countries can learn from your experience?
I think a lot of efforts have been done in UAE in general to respond and to prepare for outbreaks in general and for MERS-CoV. One of the good examples is the One Health model, where the integrated work between the animal and human health is ongoing. So this is one of the best models, I think, for others to learn from and adapt. It's not easy to integrate the animal and human sector, but it is crucial for zoonotic diseases. So MERS-CoV experience have been challenging for the whole world. There are a lot of lessons drawn from this infection that will help us to be better prepared, to be less vulnerable for future outbreaks.